everybody. Thanks for joining me to talk a little bit about community-based participatory research today. I decided to talk about it in terms of what I did during a study of adapting a face-to-face HIV prevention model to text messaging. There were other things that I could have talked about, and now that I'm thinking about it, I wish I would have included in this presentation some information on what I'm doing currently with Dr. Loretta Sweet-Jamat. She's doing amazing CBPR work in West Philly, and so hopefully I can mention a little bit of that. But the focus of this presentation is on work done for a text messaging study. So before I get into it, I need to acknowledge the fact that I was funded for this study through a grant from the National Institute of Mental Health, which came through a center at UCLA where the study was conducted, and also through a small grant for the UCLA campus chapter of Sigma Theta Tau International Nursing Honor Society. So,
Tiffany, can I ask you to hold for a second? The only thing that we're seeing is the PowerPoint. We're not seeing the slideshow mode on our screen. Have you been advancing your slides?
I have.
Yeah, we're not seeing that.
Oh, wow. Okay. That's a little strange. Do I need to enable editing?
I see that now.
Now,
now we see it. Yep.
Okay, so let me just go back to this slide so you guys can see the funding sources. I want to always be sure that I acknowledge them. And now I'll go back to what is CBPR. So there are a number of different definitions that you can find for what community-based participatory research is. This is one that I sort of like because it has a little inclination in there toward healthcare. It talks about practitioners. So CBPR is a partnership approach to research that equitably involves community members, practitioners, and academic researchers in all aspects of the process, enabling all partners to contribute their expertise and share responsibility and ownership. I think it's really important to point out that the CBPR approach is different from traditional research in that the researcher or the academic institution is not the end-all be-all for CBPR. Community members are given just as much weight, if you will, in study design, study approaches as the PI or as the research institute or the medical institution. It's a partnership. It takes away any form of hierarchy, or at least it should if we're doing it appropriately. The community members come in having the same sort of expertise as researchers or clinicians, maybe not in the same areas, but we acknowledge them as experts, just like we hope to be acknowledged as experts as well. This definition I like because it talks about all aspects of the process being a partnership. So the community does not just come in after the researcher decides what they want to research or where the research study is going to be conducted. The community is supposed to be involved from the very beginning. And so you'll probably hear me say more than once in this presentation that most people don't actually do pure CBPR, including myself. I'll state that disclaimer. This study used various methods of CBPR, but it wasn't pure CBPR in that I did not recruit or have a community team on board before thinking about, what I was going to study, how the study was going to happen. So I sort of skipped over a couple of phases, and I feel like most people do, unfortunately. It's really hard to find a true CBPR study where from beginning to end, the community is involved. All right, so the principles of CBPR, as stated by Barb Israel and colleagues, are 9. They include acknowledging the community as a unit of identity. The community is not an afterthought. They're supposed to be a part of the entire process, beginning to end. It builds on the strengths and resources of the community. So you wouldn't go in without having some sort of knowledge of where the community strengths are. You wouldn't bring something to the community that's completely foreign to them and ask them to learn about a new concept or, you know, something new. They should actually be involved in selecting and choosing what's going to be studied, the way it's going to be studied, what are the outcomes that we're looking for. They should be involved in all of it. And it's an area that they're already familiar with, either because of their own lived experience or because of some other form of expertise that they have. We're facilitating a collaborative and equitable partnership. So again, it flattens the hierarchy. There's no one aspect of the partnership, either the research team or medical institution or what have you, versus the community. Everybody has equal standing in this sort of system. And again, they're included in all phases of research. So that even includes dissemination. Very rarely will you see community members brought to conferences. We don't often see community members written in as authors on papers. You might see them acknowledged somewhere in the paper, but they should actually be listed in byline. Maybe not everybody on a research advisory board or community advisory board, but someones from the community should be included in the writing aspect, should be included in disseminating the research. One person in particular that I can think of, Loretta Jones, she's passed now, but she was very popular in CBPR communities. People who do this work knew her name, and she was adamant about taking community members with her. So if you would see her at a conference, she had somebody from her team there to present with her. And I think that's an amazing thing. And that's sort of, you know, what community-based participatory research lends itself to if we're doing it appropriately. We want to foster co-learning and capacity building among all partners. So it's not that we as the researcher or academic institution are teaching the community something, we're learning from them just as well. We acknowledge them again as experts based on either their lived experience or other expertise that they might have. And we acknowledge that we don't know it all. So we're coming in to learn from them just as much as we might think they're learning from us. We want to have a balance between generating new knowledge and the research aspect, but also developing whatever the intervention is. It doesn't always have to be an intervention. It might be policy change that we're talking about. We might be developing some form of action that happens in the community to move policy, to change thoughts, beliefs, whatever it is, we're doing it for mutual benefit. So again, it's not just about us coming into a community and seeing what we can get from them. It's really about us coming into the community so that we can be on mutual ground with them. And I think that lends to a much better research study and much better outcomes anyway. So we want to focus on the local relevance of public health problems. This is really important because community-based participatory research is not always something that is generalizable. In a sense, it is. Whatever construct you're dealing with, whatever issue you're dealing with in the community, I'm sure it's happening in other communities as well across the nation and maybe even the world, but you're dealing with a specific community, specific people within that community. And so the thought is not really to have something that's generalizable and that can be implemented across the nation per se. If that happens, there's usually some form of adaptation that needs to occur because communities are different. They're built up of different people. They have different ideas about things. Some things that matter to one community might not matter to another, even if they have similar ethnicities or they're in a similar age range, or even they're looking at a similar issue. The way that we attack cancer, for instance, in West Philly might not be the way that we attack cancer issues in North Philly even. The people who live in West Philly are slightly different than the people who live in North Philly. And so there might be some adaptations that need to occur with the intervention or with whatever it is that we're trying to do or promote. And I think it's important to remember that each community is unique in and of itself, and we should not try to take things that work for one community and automatically believe that we can place them on another community, because we may or may not be able to do that. It involves system development using a cyclical and iterative process. So community-based participatory research is very fluid, if you will. Things change all the time. We go back to various phases that we thought we might have already completed, and that's normal. It's not as prescribed as some of the research that we are used to. I think as researchers, we can get used to this idea that, you know, one thing happens and then 2 and 3 and 4, but sometimes you get to 4 and have to go back to 2, or you might have to go all the way back to 1. And that's just sort of the name of the game when you're talking about CBPR. And so it's important that we realize this, we acknowledge that things do change. The process is extremely cyclical. It's not very linear at all. And I'll actually show a model of that in a second. We want to disseminate results to all partners, including the community, including whatever funders were involved. Of course, the academic partner is going to, you know, be involved in dissemination, but we don't want to leave anybody out. We want to include all parts of the CBPR process from beginning to end. And then I think one of the most important things that we leave out is involving a long-term process and sustainability. And so when we talk about CBPR, it's not that you go and gather a group of people to help you do this one research project and then you leave those people and move on to another community. CBPR is really a process by which a researcher, a research institution, a healthcare institution partners with the community for long-term growth, learning, reciprocity of that learning. And so it's not a one-time shot. You'll see people establish community advisory boards or research advisory boards where you keep members of these boards for years. Members may come and go, people might move. Sometimes people get tired of being on a board, so you know they choose not to be on it the next year or what have you, and you bring in new folks, but the board itself stays for a long-term period, and it's not just one research project or one intervention or one policy change that takes place while the board is active. Many things happen under the reign of that board, and I think it's important to remember that. So I've talked about some of these things already, but CBPR is really important because, again, it flattens the hierarchy that we sometimes build in academia, where we see the researcher as having the most knowledge, having the most expertise, and the community members are often not even seen as participants in research. A lot of times they're seen as research subjects. I try not to use that language because it's very patriarchal, and it has us look at community members as if they're just there to do a job for us. We don't look, when we talk about having research subjects and not research participants, we don't look at community members as an important piece of the process of research. We just look to them for outcomes. And that's just really not the way that we should be going about it if we have a CBPR lens. It's also highlighting the experiential knowledge of the community members. Again, they may or may not have the number of degrees that the research team has, you know, but you could very well have somebody on a community advisory board or a research advisory board that has a PhD just like you. Actually, I talked about Loretta Jones before. In her work, she had worked with certain groups for so long that there were community members with a high school diploma that had far more knowledge of the research process and research design than some actual researchers that I've seen, because they had been involved in the process for so long. They had participated in so many different studies, and it just became second nature to them. Some of them actually went back to school and got degrees after working with Loretta because they became interested in research and in outcomes and things like that. I think the most important thing about CBPR is that it has the potential, if we do it appropriately, to decrease unintentional bias in research studies. A lot of times as the researcher, we don't see our own biases toward a community, toward even the research process itself. We become so ingrained in doing research that a lot of times we can't step back in the way that the community can and see things with fresh eyes. And even if we consider ourselves a member of said community, whatever it may be, we're different. And we have to acknowledge that. And there are things that we won't know or won't understand about the experiences of the community. And so to have their voices at every phase of the research process is really, really important. It keeps us from biasing our own research designs and our own research studies, our own interventions, because people can call us out on things that we may not even be aware of a lot of times. Okay, there are a couple of CBPR models that you might see. I'm not gonna really get into this, but this is, this one is actually revised. The first version of this one came out in 2008, excuse me, and was revised for 2013. And essentially a group of, I believe, 35 members of various community advisory boards and research boards were gathered together to sort of map out what a conceptual model would look like as far as CBPR was concerned. You see there's context, group dynamics, and equitable partnership. We always talk about that balance and equity between everybody involved. One of the largest circles in this second circle, I don't know if you can see my mouse, I'm sorry, is relational dynamics. And that's a huge part of CBPR. You have to have a good relationship with the folks that you're doing this work with. And I think people sometimes discount the amount of time that it can take to establish these relationships. So CBPR is not something that's very prescribed. I said that before. You know, it can take years sometimes to gain entree into a certain community. And that's part of the work. So it's not that work isn't getting done if you're not moving forward in the research process. Some of the work is actually gaining entree and getting to know community members and building relationships with them so that they trust you and are okay bringing you into their community, sharing their thoughts and ideas and feelings with you, and not feeling like you are there as the researcher to take advantage of them or to just use them, and not see them as equals in the partnership. We move to the intervention and research piece, which is, I think, what people think is oftentimes most important. I actually think the relational piece is most important. And then of course you have your outcomes. There's this, and then there's a slightly newer, more involved conceptual model that you might see floating around. Same sort of concept, just it looks a little bit different, and I feel like they piece things out a little bit more. So if you get the slides, you can look at it in detail. I don't really have time to go over it. So what I'm going to talk about is how I used, again, aspects of CBPR. It certainly wasn't a pure CBPR study for various reasons. When I started this study, I was a PhD student, and there are certain time constraints that come with being a student that you don't necessarily have when you're a faculty. And so some things I had to sort of jump over or bypass in order to graduate, to be honest. But I'll mention those things. I won't act like they didn't happen. So what I used was the modified adapted model. Wingood and DiClemente came up with a model whereby there are 8 different phases or stages of adaptation. And so in these 8 phases, I went into the process thinking it was going to be fairly linear. You know, you do your assessment first, make your decision about what it is that you're going to study and how you're going to do it, adapt a model, begin to produce, for me, it was memes, pictures, text messages, but produce whatever multimedia you're going to use for your intervention or however you're going to do your intervention. Take it to topical experts and have them review it to get their feedback and input. Integrate their comments into what you already had so that you have sort of a new version. of whatever the intervention is, do some training so that the people who are going to implement the intervention know what they're doing, and then go ahead and test it. First doing pilot testing and then efficacy. That's not how it went for me. So you see little half circles at the bottom, whereby the first part of this model, assessment and decision, I actually did without including anybody from the community. Again, I was a student. I had a certain framework that I wanted to use. I had a certain thing that I wanted to study. I sort of knew how I wanted to do that. I'd done enough of searching the literature and just becoming comfortable with this topic that I felt like I had a good grasp on what would be, I don't want to say what would be best for the community, but what would work in this community to help increase condom use and decrease high-risk sexual behavior. In a pure CBPR study, I would have actually gathered the community members first and established a research advisory board, which I call the RAB, and had them tell me what they thought, what issues they thought were most prominent in their community. So in terms of this study, the community was African American or Black women ages 18 to 24 who were sexually active. So those are the people that I was looking at. And again, what I should have done and what I would have done had I had the time and resources was to gather women from this community, talk to them about what they thought was most important for the community or what we should be addressing, and then use that to sort of design the research study. I did it backwards. So I brought them in at the adaptation phase, and I'll go through in a second how they helped me to adapt this intervention. But the adaptation phase, I went back to twice, because after I integrated thoughts and comments from the Research Advisory Board and also a focus group that I held to confirm the findings of the Research Advisory Board, I had to do some changes to the intervention. So production needed to be done again. We had to change some of the way things looked, took it back to topical experts, which happened to be my dissertation committee, and integrated their comments, and then went back again to additional topical experts, 20 members of a community advisory board at UCLA. All these members were people who worked in AIDS or HIV care, advocacy, different community agencies around. And so I had lots and lots of input from various people before we were able to move to the training and testing. And so I ended up with about 3 different versions of this intervention, and I'll actually have a 4th version before I get to the efficacy testing. So you see things change a lot. And again, this was not a linear model at all. So I went into this phase of the study with the aim of adapting Sister to Sister, which is a face-to-face HIV prevention curriculum. I wanted to adapt that to text messages. Text messages, well, things are a little different now, but at this time, for all intents and purposes, text messages were about 160 characters. And so I wanted to keep it to that. So short, very pointed messages that would take the curriculum in the way that it was a 20-minute curriculum, and I wanted to somehow be able to text that information to people, people that couldn't get to clinics where this curriculum is usually implemented. And so I had 5 questions for the Research Advisory Board that I was going to recruit. I wanted to know what sexual health content from the curriculum that I could use in text messages, what would be appropriate, how I could take STD information and incorporate it into the new curriculum that will be on the text messages, how I could do skill building exercises, because that's a very important component of behavior change models. And I wasn't sure how to do that in a text message. I wanted to know about frequency and duration as well. How long did they think we should send these messages out, and how often? And so I ended up recruiting 2 different sets of folks from the community. Everyone, again, was Black, African-American. They were all female. They were all age 18 to 24. And I included in this table both of the two different types of folks that I recruited. The first was a research advisory board. So my research advisory board was going to take me through from where I recruited them through the rest of the process. And I looked for 8 young women, and 7 actually ended up coming to the first meeting. And so those were the 7 who made up the research advisory board that were going to help me adapt, implement, and then assess the results of this study. And then I also recruited young women for a one-time only focus group. So the research advisory board met regularly as we were doing this work. The focus group met one time only. And the reason for the focus group was to corroborate what I learned from the research advisory board. I didn't want to just take the advisory board's word for it. Although I trusted them and trusted that they knew what this community would want, I wanted to double check with another aspect of the community. And so that's what the focus group was for. I again recruited 8 young women, and for that, 5 young women showed up. You see that there's only 11 young women included in this demographic table, and that's because one of the focus group members chose not to do the demographic survey. And so I sent it out a couple times. You know, I tried as hard as I could to get everybody to fill it out, but that's sort of one of the downfalls. You can't force people to really fill out surveys. And so the majority of the people who made up my community, if you will, were 20 to 24 years old, had a high school degree or higher. Only 2 of them had a bachelor's degree, and I think that's just because of their age. Most of them were either in school or had not gone to college yet. They were mostly working. Some of them had prior pregnancies and or prior STDs. I asked that question because I wanted to sort of get a knowledge of their sexual activity experience, because we're talking about things that have to do with sexual behavior. So the structure for the meetings was as follows. Excuse me, I want to grab something to see about time. Okay, the structure for the meetings was pretty simple. We met at a local community agency, which was really important. So with community-based participatory research, again, each partner, I'll say, the community or the researcher, is just as important as the other. So I really took care not to have things at the university. I didn't want people from the community coming to the university to meet, because I didn't want the appearance of any type of hierarchy or power struggle, right? I didn't want it to appear that as the researcher or research student that I had any more power than the members of my research advisory board or the focus group. And so we met at a neutral location, a community agency. We always met at the same one at the same time. We met on pre-scheduled days, and during the first meeting, I double checked with everybody to make sure these days were good. Most of them were on Saturdays. We met one Friday because there was a national holiday occurring on Saturday. I think it was the 4th of July or something. And so we met on a Friday. Each meeting was about 3 hours, although we didn't spend that much time meeting. So before the meeting started, we'd always have like a late breakfast, early lunch. So I would give them a meal. We sort of just sit around and talk while we were eating. And then we would actually meet where the recording was going on for about an hour to an hour and a half or so. I always had research assistants in attendance, and the research assistants were the same ethnicity, gender, and age range as the young women who are a part of the research advisory board. That was really important to me because I didn't want the appearance, again, of a power struggle. I didn't want people who didn't look like they were a part of this community to be sitting in on these meetings, because you don't know how that affects, how somebody responds to certain questions, or how open they'll be, or what they'll tell you. So the research assistants looked like the research advisory board members. They just had a different function in the meetings. They were really there to assist me and help me. although when we talked, I did allow them to engage in the conversation, and actually some of their input was really helpful. Gift cards were given at the end of each meeting, which this was a funded study, so I had the money to do that. That might not be typical for many CBPR studies every time that you meet with the community members, but you should give them something, right? You should give them something for their time. They should in some way feel acknowledged for their participation, whether that's gift cards, whether that's just having food available. I've heard of some people doing things like sending birthday cards or sending, you know, anniversaries, if people graduate or have other accomplishments in their lives, acknowledging that. You want to do that, it helps to build the relationship. I'll say that something that I was not looking forward to, I didn't anticipate, was that the end of the school year occurred and several of my research advisory board members left the area because they went home for the summer. It wasn't something that I anticipated. And so we began to use Google Hangout for the 2 people who could not be in person at our meetings, because we still wanted to give them the opportunity to participate. They were still very much a part of the research advisory board. They just couldn't be there in person. And so I started this process of the research advisory board helping me to adapt this face-to-face intervention model into something that could be done via text messaging. And I'm just sharing with you some of the comments that they made that helped us get to the final version of this intervention. These are not their real names. These are pseudonyms. But Brooklyn, she made a comment about multimedia saying, I wouldn't want to watch a long video because it's like, ooh, I only got 2 gigs this month. And so that was something that we talked about, letting us know, okay, if we're gonna include components of this text messaging intervention that use up data, we can't make them large components. So we decided that all videos would be somewhere between 30 to 60 seconds max. There's one video that's 90 seconds showing how to properly apply a condom to a penis model, but that's the longest video that we have. And we just couldn't break it down to be shorter than that because of all the parts to it. Charlotte said, honestly, use as many memes as possible. And then Delilah chimed in right after her. Yeah, memes are attention grabbers. So that was one of the things that was important for me to learn as the researcher. Again, I'm not a member of this community per se. I was a little bit older than them, but they know things that I don't know or wouldn't think about. To be honest, memes weren't on my radar really at that point, but they're important for the people in this demographic. And so that was something that we utilized heavily. We had some comments about message type or timing. And so we had different content areas of messages, which you'll see in a second. Emma said, maybe something like the positive affirmations could be during the day. Yeah, the start of the week, or like in the morning before you go out. So you kind of have that in your head, like, I'm making this smart decision. And then the other ones, she was talking about more hardcore messages, not necessarily self-affirming, reminding you to be smart. So maybe before you go out. So from that comment, we had some discussion and actually decided to send affirming text messages at the beginning of the day. So they would be the first thing you see when you wake up, and sending text messages that I don't want to say would scare you, but yeah, the more scary text messages about how STDs can basically ruin your life at night or right before the weekend. So we would send those Friday nights at 7 p.m. thinking this is when people are usually getting ready to go out. Young women, college age, are most likely to have sex on the weekends, not on weeknights when they're in school or coming home to their parents' houses. And so this is when we want to send the real heavy content. Ava said, I think nothing more than like 2 or 3 times a week. Otherwise, it just gets too much. So we were talking about frequency and the fact that you sometimes get text messages from, like, they brought up Victoria's Secret, for instance, and how they can send things so frequently that you stop paying attention and it's not important anymore. You just start to ignore it. So from those types of comments, we ended up taking the curriculum and breaking it down into 9 different areas of content. We had 4 different message types, which I'll show you an example of in a second. And then we sent messages Monday, Wednesday, Friday for 8 weeks, either at 8 a.m. or 7 p.m., depending on the type of message we were sending. And this is an example of some of the messages we came up with. So the top 2 lines, hey girl, we want to help you live a long, healthy life and make safe, responsible choices to respect yourself, protect yourself because you're worth it. That was what we considered a text message. The meme is the picture you see on the left, and the people that are pictured in the meme are actually characters from some of the videos that we text out. So we text little clips, again, about 30 to 60 seconds or so from the original curricula, where they had like 7 to 8 minutes, sometimes 15-minute videos. We text out information that was too wordy or too long to send in a text message. We sent it in what we call pictures. And then we also sent videos. We didn't send the videos directly in the text messages because of the type of platform we were using, but we sent them as links. And so the focus group, again, was held to sort of verify what I learned from the Research Advisory Board. These are just some comments that they made, helping me to understand what worked and what didn't. So people said, you know, they liked that the texts were short and sweet and to the point. They liked the memes. Kaylee said that she would send it to her friend. Like the text messages were so engaging that she would actually share them because they're short, not like 5 minutes. So you can watch it pretty quickly. Julia talked about how she liked the memes because in the social media age, that's what you do. And then Isabella talked about the frequency and how 3 days a week was a perfect amount of time. It wasn't too much and not too little. So I actually had the Research Advisory Board help me with everything from the research design as much as I could to the actual adaptation of the curricula to even research flyers. So the flyer that I used to recruit the Research Advisory Board and the focus group is on the left. It was what I could do on Microsoft Word and, you know, to the best of my abilities at the time. I thought it looked okay. They said it was ugly. They said it didn't have enough color. It was too wordy. They gave me a lot of feedback. And so I actually hired a graphic designer to do version 2, which they loved. They said it popped, the colors were nice. You know, these were things that I didn't think about myself. I didn't think anybody would care about what a flyer looked like, but apparently they did. And we actually made it in dimensions that were good for social media and for looking at things on your phone, which again, I didn't think about, but these are the types of input that I got from the young ladies on the board. So at the end of it all, I asked them at our last meeting before we started implementation of the actual intervention, how they felt about being on the Research Advisory Board. And I got some really good feedback. One person said that she really appreciated how aware it's making her, that a lot of times you just go through the motions and not really think about everything being a person's own sexual behavior. And so she appreciated that. Another person said, I enjoy being a part of this Research Advisory Board because it's been both informative and fun. And so I was glad that the participants thought that their time was time well spent, and that they enjoyed themselves. Actually, several of them have gone on to apply for graduate school. 2 of them applied for medical school and asked me to write letters of recommendation. So we maintained relationship, and for most of them, this was their first introduction to anything having to do with research. And they enjoyed it. They really liked it and wanted to continue on in that vein, which made me really proud. So after adapting the intervention, the training piece was just basically testing whether or not the text messages would work. I offered everybody the ability to participate in this, and 4 of the research advisory members out of the 7 took me up on that offer. So they actually received the text messages before we implemented it as part of the research study. Following, I'm not going to talk about the results of the research study, but following analysis of the data, I took it back to the Research Advisory Board again to say, hey, this is what we found when we implemented these text messages. What do you think of this? Can you help me understand maybe why some of the data looks the way that it does? one of the things that we found was that nobody was recruited from Craigslist. We did a lot of recruitment. Actually, all of our recruitment was done online. I'm writing a paper about that now. And I was wondering, why didn't we get anybody from Craigslist? We spent a lot of time putting ads on Craigslist, and somebody replied, Craigslist is for creepers, which helped me to understand that's probably not the platform we should use. The people in this age group are not going to Craigslist to look for anything because they think the folks on there are old, strange men. And so they stay away from it. We had a lot of participation in the study from people who learned of the study using Facebook, and I wanted to know what their thoughts were on that. And so they were saying how they actually trusted Facebook. Charlotte was saying, if you see something on Facebook, you're not wondering about the credibility of the person behind it because you actually trust Facebook. Now, this was prior to some of the issues going on now where Facebook is probably a little less trustworthy and some people have actually left the platform, but this is what was going on back then. And I also asked about snowballing because snowballing was actually the highest method of recruitment, even though I didn't think that it would be. I asked why, and one person said, so if you have a girl and she found out about this study, if she gets her girlfriend to agree to do it with her, she'll probably do it. So this idea of friends doing things together because they trust one another. So if I'm in a study, I bring my friend on, or I tell my friend about it, she'll probably do it. We had some issues, some perceived issues, at least with contamination. And I was wondering why. And they gave me input on that. They could be talking to each other like, hey, what's going on? Well, I didn't get that, talking about a certain message. Okay, well, let's just exchange the messages. You show me what you get, I'll show you what I get. Because there was I had some inclination about people sharing messages from the control group and the intervention group. And this is their response, which helped me to understand, okay, they could be sharing messages. Another person, one of the research assistants, talked about the fact that somebody actually admitted showing the text messages to her friends. And so she was saying maybe those friends were close. They were in the study together. Maybe some of them were in the control group, and they showed the people who were in the control group showed their videos to people who were in the intervention group. So that helped me to sort of think about contamination in a different way. We also talked about the acceptability and feasibility outcomes of the study. Charlotte said she was just happy about the results. She said, I feel like we worked hard on it, making the text messages, and most of the comments were positive. So it feels nice. I really enjoyed seeing them take ownership of this research study. I don't feel like it was my study. I feel like it was our study. And in the follow-up meeting I had with them to show them the data, that came across. They were really happy to see the results of the study. I tried to explain it in terms that they could understand. I didn't just throw a bunch of numbers up on the screen and show them, but they really took ownership of it and were happy. Delilah said, it makes me feel good, like we're of service to those little ladies out there in need. I thought that was really funny because you are the little ladies, like you're a part of this community as well, but they saw themselves as part of the research team, and they were. And so I thought that was a really cool comment. We talked about video views, and there was some issues with, on the back end, I could see how many times somebody opened a link, how many times they clicked the start button, how many times they watched the video all the way to completion. And there was some discrepancy between what the study participants reported about how many times they watched the video and what I could see from the back end data. And I was trying to figure out what this discrepancy was. So we talked a little bit about that. Charlotte was saying, usually people don't want to admit when they don't do something. So they might have said they watched all of it when they really didn't, because they didn't want to look like they didn't watch anything. They were covering their tracks. And Delilah made a really good point. She said, if I'm on the phone listening to music and the phone's about to go off, I'll turn the station or turn it off. I mean, the song's about to go off, I'll turn. She said, like when the chorus is dragging on, or maybe somebody's like talking during the outro or something, I'll just turn it off. And that brought up discussion of, maybe people did watch the entire video, but a lot of times you'll have 1 or 2 seconds at the end of the video where the screen is black or it's fading out. And if they don't watch those 1 or 2 seconds, then the computer system doesn't pick up the video as watched to completion, although they did watch all the content. And so we talked about how this is why it's important to talk about these things and not just trust what we can see in back-end data, because it might not give us a clear picture of what's actually going on. We talked a little bit about the decrease in sexual activity before and after the intervention among the control and intervention groups. And so I was trying to figure out, you know, why that might be, why people in the control group who did not get any sexual health text messages might have decreased their sexual activity. I thought it was really funny. Charlotte said, relationships come and go. Like, I don't know, sometimes you get in a drought and it seems like a dry spell. And she said, it's just one of the ins and outs of being a single lady in Los Angeles or in America. So remembering that these are young adult women who may or may not be in monogamous relationships. A lot of times when you're younger, relationships can end more frequently. They might not be as long-term as you like. And so definitely 1 month you can be in a relationship with somebody and having sex with them, and 2 or 3 months later, you're no longer in that relationship. And so you're not engaging in sexual activity because you're no longer in a relationship. Lastly, I just asked them about their experience. How did you enjoy being a part of this research advisory board and helping to adapt these text messages? Charlotte said, thank you for giving the opportunity for being on a research advisory board. It was a fulfilling experience. Delilah said, this was a great experience. I've never done an intervention like this. I don't know, I just thought it was really cool and we put a lot of work into it. And then Grace said, remember I was thinking like, should I go? It turned out pretty nice. I was happy I came. A couple of tips that I can give really quickly about doing community or using community-based participatory methods in your work. Definitely recruit more participants than you think you'll need, always. With the research advisory board and with the focus group, both times I recruited until I got 8 people who said they would come to these meetings. For the research advisory board, only 7 showed up the first time. And for the focus group, only 5 showed up out of the 8. So you want a number that you want to over recruit, because you never know if everybody will show up or not. You don't want a number that's too high though, because it's fairly difficult to hold any type of focus group or meeting, particularly when you're recording, when you have more than about 6 to 8 people. You want to set group expectations early on. So we talked in our first meeting about the dates that we would meet, how long those meetings were. They knew that I would always provide a meal for them, that they would always get a gift card at the end of our meeting. And we set expectations for how the meetings would go as well, like what we would cover each time we met. Include community in every aspect of the phase. I cannot stress this enough. The community should be the ones that are telling you what's most important and what's priority research areas for their community. They should be the ones who help you to design the study, but also help you to interpret the findings. I don't know what I would have done for my discussion section if I had not gone back to the research advisory board members and asked them their thoughts about the research findings. If I had not taken the data to them and asked them to help me interpret why they think this was, I would have been clueless, to be honest, about most of this stuff. Making all decisions together is extremely important. Again, I didn't do it to the T because of time limitations and other things, but deciding every step of the process, what's going to happen and how it's going to happen, and allowing the community to guide us is extremely important. And then keeping in touch between studies. So again, I use this research advisory board for one study, but actually have been keeping in touch with some of them now for several years. And in a pure CBPR format, you are doing multiple studies over many, many years with members of the community. You don't want to just, disappear in the middle of studies. You don't want people to think that you're only in relationship with them because you want to get something from them. You want the relationship to be mutually beneficial. You want the community to trust that you're not just there to take from them. You want the community to see you as a member of their community, actually. And so you want to do a good job of relationship building and maintaining contact with people, even when the research activities aren't occurring. This is a picture. I can't show you pictures of the actual community advisory board or focus group, but this is a picture of myself and my 2 research assistants at graduation. We all happened to graduate together. One of the research assistants, Stephanie on the left, she was in the bachelor's in nursing program. Dejan was in a master's in nursing program, and I was in a PhD program. So we sort of grew with each other and went through our various programs together and got to celebrate graduation together. So now I would love to open up for questions just about my experience with the text messaging adaptation study, or with the use of CBPR methods at all.
That was fabulous, Tiffany. Really phenomenal information.
Thanks.
Tiffany, what I was really impressive is how much you embodied the process. And I just was curious, from your experiences or advice to others, what would you suggest for someone who's not done this or may not be as familiar in terms of really, because it isn't the traditional medical model, right?
Right. So my first suggestion would be to just be open to whatever you find. A lot of times we go into the process thinking we're the experts, so we know what the issues are. We know what people want to know about the issues. We think we know how they want to deal with the issues. That's not always true. And so I think the first step is to actually recruit a research advisory board, community advisory board, whatever you want to name them, and then start talking to them about what's important. I didn't get to talk about Dr. Jamaat's work that she's doing right now, but one of the first things that she did when she got to Drexel was she spent time, about a year or so, just going out into the community in West Philadelphia and asking people what health related issues she thought the community was experiencing. She interviewed about 1,100 people in this time and was able to come up with 7 key areas that were of importance to this West Philadelphia Promise Zone community. And from there, we began to tackle, we chose cancer first, but began to tackle different priorities that they have for their own health and well-being. She didn't go in with a preconceived notion of what she would want to research. She went in almost, tabula rasa, blank slate, and let the community tell her what was important, and then designed a study with the help of the community from that point on. I think that's how we do it. It's not what we're often taught, but that's the way that we do things effectively with CBPR.
I was involved in a study from PCORI, which is designed to engage stakeholders in the research process. It doesn't necessarily have to be participation, action, or community, but I think you underscore, from my experience in a study where we had 7 parents of children with cerebral palsy who were part of our research team. Mm-hmm. And as you mentioned, they were part of our team. They presented with us, and that so that was one even distinction we would sometimes have to make with talking to others, that no, these are part of our team.
Right.
But I think it's the relationship. And one of the things they told us, because it was a 3-year project, they said, one of the reasons we stuck with you, because we knew you were listening to us from the beginning. Mm-hmm. We felt that you valued. And one of the things we learned, so it's not exactly yours, but I'm just trying to relate, is that we learned to ask open-ended questions. Because when professionals say, what do you think about this? We're often doing it from a biased, our lens. Mm-hmm. So I learned a whole lot by just asking open-ended questions. They would contribute information that we never would have thought of.
Yep.
So
Anybody else?
I got a question for you, Tiffany, about the, so you mentioned that you would incentivize people with a gift card at the end of each meeting. Mm-hmm. So I have some questions about that piece. How much was the gift card, and was it always the same every time, or did you accelerate it, saying if you participate in 5, you get a bump?
No, so for the research advisory board, they got a $50 gift card for 3 hours of their time every time we met. So there were supposed to be 4 meetings. At meeting number 4, only one person showed up, so I couldn't actually use that as a meeting. I ended up having essentially a one-on-one interview with her about what was going on in the process. And so we added an additional meeting, so 5. But every time, you know, you showed up, you got a $50 gift card to Target. Now in the actual intervention, it was different. I gave a $25 gift card at the beginning and a $50 gift card at the end. I can't remember. I might be making that up. But the numbers were different. I gave a slightly larger amount for an incentive at the end of the study, hoping that it would bring people back and allow them to complete the study.
Cool. Great, thank you.
Yeah. Tiffany, thanks for such an awesome presentation. And what a cool study. Like, I can see how this could be, you know, could have been really fun and fulfilling, and also so beneficial to the community. So definitely an inspiring presentation. So thank you. I was just curious if you had any additional advice on how to choose members for the Research Advisory Board, especially if, I mean, I don't know if you would you reach out to people you might already know in the community, or if you just put out an announcement and you got way more people interested than you needed? Like, how do you go ahead and pick and choose who gets to be a part of that board?
So for me, I wanted to make sure that people involved in the Research Advisory Board were of the same demographics as the people who I would use to participate in the actual implementation of the text message study. And so that was key. So I had a very peculiar, particular, unique group of people that I was going after. I think it's a little bit more difficult when you look at, like Dr. Jamaat is looking at an area of the city where people on the Hub's Community Advisory Board come from all walks of life, are various ethnicities, various age groups, because she's looking at people who live in the promise zone, not necessarily you know, a particular age range, gender, and ethnicity. I think that makes it a little bit more difficult, but over time, a lot of times you find who is committed to the process. When you first start out meeting as a community advisory board, if you're doing pure CBPR, you don't even have a research question. You don't know what area you're going to research for the most part. And so there are lots of meetings and it takes time to sort of get things going. And I feel like people usually weed themselves out. The ones who want to stick around and come to monthly meetings do so. And they're really interested in the research process. And those who, you know, it's not all that interesting to them, or they don't have the time and can't make the commitment, they sort of fall off. And so you almost don't have to do the picking. Time sort of does it for you a lot of times. Was there a comment, Darren?
The only comments have been Justine and Rebecca Dietrich Hartwell both needed to jump out for a 10 o'clock meeting. They wanted to thank you for the presentation, and then they
Got it, I got it.
All right, well, thank you all. Let's hear it up for Tiffany. Great job. That was fantastic. That was really, really great.